euthanasia of brain-dead patients. Today I'm going to present an explanation of what brain death and euthanasia is, as well as how euthanasia pertains to brain-dead patients. I will also discuss the psychological implications for family members of euthanized brain-dead patients. Included in my presentation are statistics on brain death, as well as the legality of declaring a patient brain dead. I also will cover the discussion of who decides to turn off a brain-dead patient's ventilator. Definitions. Brain death is defined as if both the neocortex and the brainstem stopped working, a person could be pronounced dead. As evidenced by the image on the right, in brain death, neuronal activity ceases to exist, illustrated by the black empty space in the brain on the far right. Euthanasia is the act or practice of painlessly putting to death a person suffering from a painful and incurable disease or an incapacitating physical disorder, or withdrawing artificial life support measures. While removing a ventilator from a brain-dead patient can be defined as euthanasia, it is not commonly defined in that manner. However, it still falls under the definition of euthanasia. How does brain death occur? When the brain is injured, whether by natural causes or by trauma, there are three possible results. Bleeding, swelling, or both may lead to brain death. Trauma can cause brain death through open wounds, which include gunshot wounds, or closed trauma, such as a blunt injury. Massive bleeds in the brain, hemorrhage, or lack of oxygen reaching the brain, anoxia, will also lead to brain death. Cerebrovascular accident ischemic due to blockage of an artery can also lead to brain death, and tumors are another cause of brain death. A doctor declares a patient brain dead through a series of tests that comprise the three clinical criteria for brain death. The brainstem no longer functions, spontaneous breathing is not initiated during an apnea test, and the patient is in an irreversible coma. Functions of a brain dead person. After a person has been declared brain dead, he or she can no longer maintain normal blood pressure or regulate body temperature. That person is unable to secrete hormones necessary for biological functions and cannot initiate breathing. Electrical impulses are also no longer being sent to the brain. However, the heart can be unassisted for less than an hour after brain death. Brain death statistics. Brain death tends to increase every year in the United States, as evidenced by the graph on the right. It is more likely to occur in males than females, and also is more prominent in large urban areas. Brain death accounts for 2.6% of deaths in American hospitals and is mainly caused by primary nervous system diseases. Ventilators. Ventilators are used to perform the functions necessary to keep a brain-dead person breathing. A ventilator carries air moistened by a humidifier into a person's windpipe through what is called the endotracheal tube, illustrated by the image on the right. Without it, a brain-dead person's heart will eventually stop beating. However, many families struggle with turning off a ventilator when their loved one appears to only be in a coma. As of January 2009, California provides families a reasonable brief period of time between declaration of brain death and the removal of the person's ventilator. Who decides to remove the ventilator? Family, patient, doctor, or court? In 2013, Jahi McMath, a 13-year-old girl, was declared brain dead. In direct contrast to her mother's wishes, the doctors decided to remove Jahi from her ventilator. Petitioning the state courts, Jahi's mother gained an extension of life for her daughter. This is just one instance when conflict has occurred over who has the authority to turn a ventilator off. If a patient had previously declared before brain death if he or she wanted to be an organ donor, that person would be kept on the ventilator until the organs could be removed. However, in the cases where the patient had not specified, families usually defer to the doctor's decision to remove the brain-dead patient from the ventilator. But in extreme cases where the family members fight the doctor's decision, The court system must decide whether or not to remove the ventilator. They must take into consideration the fact that the brain-dead patient is using resources that could be used for someone who needs them more, as well as the question of who is paying for the care that the brain-dead patient is receiving. She's still asleep. Jahi McMath's mother believed that her daughter was still alive and only sleeping, rather than brain-dead. She had her daughter moved to New Jersey, where Jahi could remain on the ventilator and did for 5 years. Jahi was declared dead again in New Jersey in 2018 after complications from liver failure. Legality of brain death in the U.S. The United States has an overall definition of brain death, defined in the 1980 Uniform Determination of Death Act, UDDA, as an individual who has sustained either 1. Irreversible cessation of circulatory and respiratory functions, or 2. Irreversible cessation of all functions of the entire brain, including the brainstem, is dead. A determination of death must be made in accordance with accepted medical standards. However, as shown by the map on the right, not all of the states enact the UDDA in the same way. The dark blue states have enacted the UDDA as written. The light blue states have also enacted the UDDA, but the brain death concept only applies when artificial life support is being used. In the gray states, brain death can be permissible, but it is not required in any circumstance. Finally, in Virginia, the only black state, brain death must be followed by the loss of spontaneous respiratory functioning in order for death to be declared. Families' responses. With the declaration of brain death and the subsequent removal of the patient's ventilator, family members often experience Elizabeth Kubler-Ross's 5 stages of grief, which is comprised of denial, anger, bargaining, depression, and acceptance. While all family members may not contend with every emotion or may encounter them in a different order, the emotions are still present and are similar around the world. Family members express denial that their loved one is dead, anger that may be directed at the patient's doctors, bargaining with a higher authority they believe in, depression from the fact that their loved one is gone, and finally, acceptance that he or she really is dead. Conclusion. Brain death is not just about the legal, medical, and ethical implications. It deals with the death of someone who once led a full life and the grief process of the patient's loved ones. Because the brain-dead patient on a ventilator looks alive, it makes it even harder for family members to relinquish and say goodbye to their loved one. The most significant thing to remember about brain death is the fact that real people have to deal with the ramifications of it. Brain death does not end with the shutting off of a ventilator. Like any other death, it follows home those who cared about and for the patient. Brain death is about real people, not just the legal implications it causes. Bibliography. The following is a list of sources I consulted for this presentation. Bibliography continued. This concludes my presentation on the euthanization of brain-dead patients. Thank you.